Welcome to Let Go, Let EFT, where we are learning and leaning in with you, with your hosts Michelle Puster and Dr. Laura Spiller. EFT is a beautiful model helping people connect with themselves and the people that matter the most, developed by Dr. Sue Johnson.
Good morning.
Good morning, Dr. Spiller. So here we are talking about responsive versus spontaneous desire in our sexual series and how that pertains to EFT and our couples work, our EFT couples work.
And I have to admit, this is one of those topics I really wish I had understood more earlier. It's really, really helpful. So I'm glad we're talking about this.
Yes, and it can make a huge difference for couples. And I think so let's just get into what it is so people know what we're talking about when we say spontaneous versus responsive. So spontaneous is that your interest in sex just spontaneously appears. You know, you see something that's maybe remotely sexy content, even talking about sexual topics, hearing something, or maybe you see a clothing item, maybe you see your partner, and then you just spontaneously are interested in sex. And circling back to the accelerator brake, it's kind of like you have it's very easy to hit your accelerator and it's very difficult to turn on your brakes. So that shows up like you being a spontaneous desire person. And then responsive desire is responding to pleasure that's already unfolding. So that might mean that you're kissing, you're holding your partner, you're caressing each other, and then you start to feel desire for sexual interest kind of unfolding inside, blossoming inside. Is there anything you would add to that definition?
Yeah, and I think, what comes to my mind is that image where one partner, it's Saturday night, you've had a nice dinner, kids are asleep, they've been sleeping really well, so you know that they're probably not going to pop out of bed and come down the hall to your room. And your partner starts to rub your shoulders and say, hey, it's nice and quiet tonight. And one partner will check their body and say, do I feel like having sex?
Mm-hmm.
And our model is this one for spontaneous desire that says, oh, when I think about, do I want to have sex? And I think about how that would be nice. And I picture us, having some private, romantic, intimate time. My body should respond. And in spontaneous desire, that's usually enough to at least light the match, right? Start to warm things up. And I think so many people, those with responsive desire, check their bodies with this really nice invitation and this kind of, low brakes context, and they don't find that spark.
Mm-hmm.
And what I love about this concept, that's normal.
Right. Because that's not the message we get. We get the message.
Not the message we get.
In TV shows, movies, porn especially, it's spontaneous desire is the standard, is the norm. That's what and maybe, not everybody, but a lot of times people experience spontaneous desire when they're early in their sexual relationships, so then it changes over time. Yeah. And so then they feel like something is wrong and they start to feel broken. They start to question themselves. And so, yes, even knowing, oh, this is a thing. Oh, this is normal. I'm normal. Lots of people experience this. I'm not alone. Or lots of if maybe you're the partner who experiences spontaneous desire, understanding that responsive desire exists is really helpful.
Yes.
Because otherwise it's either something's wrong with my partner, something must be wrong with me, they're not interested in me the way I'm interested in them, or something's wrong with us. And all of which kind of exclude this other thing, which is responsive desire is perfectly normal. Lots of people experience it. And and it doesn't mean anything's wrong.
When I think about, yeah, when people don't know all of those things, that you're talking about, when they check their body and they don't feel that, sparking, they get confused. And like you said, they may, say no. And I just want, yeah, I add too that there's a difference between wanting sex and feeling arousal. And that can be confusing for people too. That's that discordance model piece, that sometimes you can want it and not feel arousal. And sometimes you can feel arousal and not want it. Just a quick aside, and then the whole couple gets frustrated that they both kind of want it, but they're wondering like, why is the spark not happening? Why is this like kind of not heating up? And then if they're thinking that they're sort of broken or that they're doing it anyway, then that doesn't lead to the actual creation of arousal and desire.
Right.
So then you start to kind of have all these other problems. And I think this is a good place to talk about, I love Emily Nagoski, and we've talked about her a lot. This is where I've really come to understand this, but her party metaphor.
Yeah, that's what I was just thinking too. Yeah,
Yeah.
so the party metaphor that Emily teaches is, let's say that you and I want to go to a party, and I'm always ready for a party. Like, yes, I love parties. Parties are super fun. Let's go. And you're like, oh, I don't know, maybe, I don't know, like maybe a party might be okay. And then you get you're like, okay, I'll go to the party. So you get dolled up and you're like, kind of like, oh, I don't know. But I'm going because, usually when I go to parties, I enjoy it. And then we get to the party and then, you start to see people you enjoy and you start to be, start to like relax and I'm here and you start to have fun. And now what felt like, I don't know, do I really want to go to this party is like, oh, I'm so glad I came. I'm having such a good time. And then when we're leaving, we both kind of like, oh, that was so fun. I'm so glad we did that. Even though you were like, I don't know, I guess I'll go to the party. I know I usually enjoy parties when I am there and I usually have fun. I'm usually glad I went. So, okay, I'll go. And I was like, let's go to the party. And that's kind of what spontaneous and responsive desire can feel like, right? That responsive desire person might start to, engage with their partner sexually because one, it's feeling nice. It's enjoyable. They're not quite sure, do I really want to have sex? Do I really want this whole thing? But I'm enjoying my partner. I'm enjoying like their kissing and caressing. And I usually have fun at the party once I'm there. I usually enjoy our sexual experiences. It's usually fun. I usually experience pleasure and I usually am glad that we did that. I mean, how many times have you felt like, gosh, I wish I did. Why don't we do that more often? Like it's been, I don't know how long it's been, but why do we wait so long between times when we have sex? Like, why don't we do this more often? Right. That's a responsive desire person. Is there anything you would add to that party analogy?
Well, I just think, the breaks are relevant to both, intimacy and the party analogy, right? There's good reasons why one person goes, oh man, I want to go to the party. I want to see my friends, but we got to arrange a babysitter and it's, parking's bad. I don't know what I'm going to wear. And it just is a mixed bag of feelings and thoughts about the party. And it's totally legitimate. And that can be sometimes the same, when it comes to sexual intimacy. And so it makes so much sense that there's not that initial spark.
Right.
But when you get to the party and you see the people that you enjoy and there's good food and fun music, and you really have a good time, then it's about the pleasure that you experience and share. And that's kind of the, we're not saying you should force yourself to go to a party with people you don't like, or things that happen, things are happening that you don't enjoy. That is absolutely not the thing. We're not saying like, hey, you just have to try it and you'll probably like it.
No.
That's when, I know that's a common kind of concern sometimes, misconception about this. But if you're going to a party that you do want to go to where people are doing things that you do enjoy and they're with people that you like spending time with, that's where maybe that realization that initial feeling is kind of like getting over the hump and opening yourself up to what would happen, if I were to notice how much I enjoy or not enjoy these things that are happening.
Right.
Yeah. Anything else you'd add to that? Kind of like, yeah, so I guess maybe this is even gearing into like, what would you tell somebody who's listening, maybe not, even therapists saying, oh, wow, I think I have responsive desire.
Well, I was thinking about how this shows up for couples and becomes painful when
Yeah.
you don't know. Like, some of the things I've heard is it felt like I was duped. My partner was really sexual, then we got married, and then we had kids, and now my partner doesn't seem interested in sex, doesn't seem interested in me. Other times people say that they don't, they feel like their partner's making excuses. Um, the people that are more responsive desire often say, I feel broken. I don't know why I don't want to have sex. And I think that it's just like what you're saying. They don't realize they're checking in with their body, which is a good thing. They
Yeah.
don't realize that they're like, I don't know. I don't know if I'm going to be able to feel sexy. I don't feel sexy at the moment. I'm doing the dishes, or I don't feel sexy at the moment. I just put the kids to bed. I don't feel, and they're like, how am I going to get from here to there? And they're like, I don't think this is going to happen. And they don't realize, oh, can be this slow progression, this slow build. So it can cause a pretty painful dynamic, especially if it turns into one where the spontaneous desire person is pursuing and maybe even harassing or coercive or really
More
frustrated.
breaks, right? That like
Right. Now this is hitting the responsive
relational alarm.
desire. Right. This is creating all kinds of alarms, and now it's relational. Now this is where our EFT training is so
Yeah.
helpful, right? Because we can understand how this starts to break down. And so the responsive desire person, can start to feel like pressured, can start to feel like now this whole sexual thing is a stressful thing. And I don't really want to go there because it doesn't go well. Or people force themselves to be sexual when they don't want to be. They try to be sexual and kind of like just get it over with. Now they haven't gotten a chance to let their body feel arousal. They just feel like I should just get over with for my partner. And so that also decreases desire, creates negative sexual experiences for both people. Um, so these are some of the painful ways that this can start to get couples caught in cycles where, and I think you mentioned this before, when for some couples they hear about this and they're like, oh, and it's just like something clicks and it's easy breezy and they kind of move forward. For other couples, if they've been caught in a negative cycle around this for years, it's probably going to take a lot of processing of all of the pain and hurt now that have accumulated over
Around it. Yeah.
Yeah.
Yeah. And you think about like all the ways our fear fills in the blanks when we don't have other explanations, and responding to the pain of rejection or the pain of feeling there's something wrong with me and my partner's disappointed in me. And if that's happened for a long time, yeah, we can have these patterns of thoughts and protection around that can be, it isn't, you can't flip a switch and have it suddenly go away. Um,
Right. So it's kind of like when
I
we
like EFT therapist helping couples do this.
right. It's kind of like when we first introduced the cycle to couples. Couples don't immediately, well, most couples that aren't it would be really couples that aren't coming to therapy probably that would hear about the cycle, or maybe they're doing really well for the most part. It's just like a very mild cycle kind of stuff. And they hear about it and something clicks and they're like, oh, okay, they get it and they just run with it, right? That's not usually the couples that we see in couples therapy because they've been stuck in this difficult place for a long time. There's lots of reasons they're getting stuck in the cycle. And so it's similar to this. If we present this and we present it in a similar way, hey, it's not you, it's not you, it's not your relationship. It's this thing that you're getting, you didn't know about spontaneous versus responsive desire. You didn't understand that. And so then you started, having reactions based, like you said. I love the way you put that, what the fear was telling you. And so it probably is going to maybe start to take the edge off of the pain. But that's it. Then we're going to have to sit with them and process the potentially the years of pain that this has caused. So over time, we keep presenting it similar to presenting the cycle and letting them kind of letting it wash over them, helping them understand how the lack of information or misconceptions, how it affected them individually and as a couple, and they get to process their pain. We get to validate their experiences. And over time, that starts to help couples shift and change out of what sometimes can be a pretty difficult dynamic.
Really. Yeah.
It can be a heavy one.
Yes. And so hopeful, though, to have this other way to conceptualize, and understand what's happening.
Yeah.
So helpful. And then I know we haven't followed our usual outline here, and we only have a few more minutes before we have to wrap up. But I like what you're saying in terms of takeaway for therapists who are doing this. I mean, it really is important to share this psychoeducation with them. And right, just recognizing that you kind of need to walk alongside them to help them understand it and integrate it and see how it relates to them and put it all in the cycle. And then help them take risks and be vulnerable and talk about their experiences and provide safety and responsiveness for one another as they are even talking about this concept, how this could be and how it was for them to feel rejected or to feel like there was something wrong with them.
Right. And so you can think of it very similar to how we think of this cycle. It's not, just like with the cycle, we're trying to simplify something that's not simple, but it does help to start to simplify it to kind of, like you said, we give them the psychoeducation and then we start to ask them, so what do you do when this happens? Do you press and push more? Do you give up? Do you just get it over with? Do you, how to each of them, like what are their behaviors? And then you start to track what are their behaviors and then what are their underlying feelings. So you're starting to track what they do. And of course, there's different scenarios where they do different things. There's probably historically, I first was doing this and now I do this. And, how has it evolved over time? And then you can start to track injuries.
Yes.
Listening for how this has caused injuries. And we call them specifically erotic injuries because we might be able to heal like relational injuries in general, but if we haven't healed erotic injuries specifically or given them a chance to voice those, they probably are still going to be sitting there. And other blocks that the couples that you're hearing, other blocks to intimacy, blocks to feeling safe, blocks to emotional connection, blocks to, it might just be more basic blocks like the kids are awake or I'm afraid the kids are going to walk in. So those are some things you can start to track when you're after you've done a psychoeducation about responsive versus spontaneous desire.
No, that is so helpful. And I just thought, hey, we need an episode on erotic injuries.
Yes, that is a great idea. That is a great idea.
Anything else you want to wrap up with? Okay.
Yeah, I guess the action steps I would take are knowing that you're going to present this in a psychoeducation way, and then you're going to present it again and again and again, right? And then you're going to make it specific to them and the couple, and you're going to be doing that just like we do in regular anything in EFT. We validate their experience. We say, oh, it makes so much sense how you showed up that way, given XYZ is happening for you. And then, of course, we would suggest reading Emily Nagoski's books, the Come As You Are does a really great job of going in depth on responsive versus spontaneous desire. And then she also has a new book called Come Together. And it's great for couples specifically. And actually, I think she did an updated version of Come As You Are, and she specifically talked about that misconception that you brought up earlier. So I think that's a helpful. And if you want to do a Cliff's Notes, or just kind of look for podcasts where she's getting interviewed, because you'll learn a lot. There's lots of podcasts on this topic. And then I would say, get peer supervision, reach out to a supervisor if it's a topic where you don't feel like you quite are as knowledgeable as you'd like to be, or you just want to get comfortable talking. This great peer supervision, the two of you can talk through, how is this coming up for your couples? Where do you feel stuck? So I always recommend getting lots of support, because this is hard work.
Totally. That sounds great. I don't know that I have anything to add to that. Yeah.
Well, this is a fun topic.
And do put in the show notes in the comments if there's anything else that you want us to talk about or have questions about or need clarity on or have experience when you're working with clients and these topic comes up. We'd love to hear about that. We really appreciate the comments because it helps us stay motivated and think about new episodes and energized.